Psychotherapy Documentation, Part 2. I'm Dr. Suresh Padadmat, Professor of Psychiatry, working at NIMANS, Bangalore. In this video, I'll be discussing about psychotherapy documentation and also elements of psychotherapy documentation. Documentation in psychotherapy is a professional work in order to facilitate the provision of services by the therapist to ensure accountability, continuity of care, and to meet other requirement of the institution or by the law. They are not only utilized by the clinical team but also by the reimbursement, disability team, insurance, and for litigation, especially in the court of law. The various ingredients of the psychotherapy documents are referral letter, intake notes, consent form, detailed evaluation, scales, psychological assessment, session notes, also called as progress notes and case notes, psychotherapy notes, referral, termination or dropout, and finally the formulation and summary notes. Let's look into the types of documentations based on the therapy. Psychotherapy can be individual therapy or individual therapy for the adult, maybe for a child. Even individual therapy with regard to dementia patients. Based upon the type of therapy and the client, the documentation varies slightly. Sometimes if you have to do joint session, marital therapy, family therapy, group therapy, combination of above therapies can happen. For example, you have started with the individual therapy with the client. Later you come to know there is a marital conflict also. You may have to parallelly start marital therapy, or else you may refer to a therapist who is doing family therapy, or else you may find that marital issues may come in the individual therapy and may hamper the individual therapy. In such a scenario, you may refer the client for marital therapy with the other therapist. And the therapy can be in person, it can be online, it can be hybrid mode also, based upon the type of therapy. By the institution or the organization, the documentation varies. Next question is when and how to document. Documenting, it can happen during the session. Before you start the documentation, please discuss with the client whether he is comfortable if the therapist is documenting. Many a time, clients want the therapist to have a direct eye-to-eye contact. If the therapist is continuously documenting, the client may switch off. Hence, discussing with the client is very essential, taking their consent so that the client is comfortable, even the therapist is not looking at the client. Here, many of the psychotherapists who are experienced usually take 15 minutes post-session to document. That is, it can be after the end of the session, or maybe at the end of the day, or sometimes they would have done the audio recording of the session. That can be utilized for documentation. Sometimes many of the therapists do minimal documentation. That means after the session, they will have checkbox which they will tick and document very minimally. Many of the psychotherapy institutions, medical institutions, medical colleges, for the purpose of academics, they do a comprehensive documentation. Sometimes you may also consider supervisor notes can be included here. Now, moving to the types of documentation. There are two important types of documentation. One is progress notes, another one is psychotherapy notes. Progress notes also has been called as session notes or case notes. Psychotherapy notes is also considered as process notes. In the progress notes, the patient data, legal issues, life events, patient's behavioral symptoms, psychological symptoms, emotional symptoms are documented. These are documented during the session or immediately after the session. It is mandated by the law. It is a part of medical record. Client has the right to access these records. There are various standard operating procedures, legal formats, clinical guidelines, how to document session notes have been clearly dictated. If you move to psychotherapy notes, also called as process notes, these are therapist unstructured notes. It can be scribbling, it can be diagram, it can be flowchart, it can be anything. It is not legally mandated that you have to have psychotherapy notes. It is usually not part of the medical records. Based upon the jurisdiction, based upon the profession, psychotherapy notes can be documented. They are usually unstructured. They are not part of the medical record. They are kept separate. And please remember, many of the countries do not consider psychotherapy as a mandated by legal, and patient do not have right to access these psychotherapy notes. For example, the progress notes or the session notes, the following format has been prescribed by various clinical guidelines. Invariably, these are the commonest headings which you can see. One is date of session, starting time, stopping time, any medication prescription given, any monitoring, homework schedule, homework notes, who has accompanied with the therapist, who is accompanied by the client, diagnosis, functional status, symptom, progress, suicide or homicidal ideation, and next appointment. This is the rough format of a session notes. Now let's move into the elements of psychotherapy documentation. These are all part of various professional bodies which talk about psychotherapy, and these essential elements need to be kept in mind. First and the foremost is responsibility of these psychotherapy records. Mental health professionals such as psychiatrist, psychologist, social worker, nurses are responsible for documenting, recording, storage, retrieval, and disposal. That means it is the prime responsibility of the psychotherapist. Therapist should maintain progress notes and, if required, psychotherapy notes. One need to know the difference between both the notes. That is very essential. Psychotherapy notes are not legally mandated, and you need not document that, whereas session notes is legally mandated across the globe. Content of the records. What should I write? Therapist must know what to write and what not to write. It is the clinical wisdom, professional discretion, clinical guidelines, legal mandate. Based upon that, the contents are recorded. Please remember, do not manipulate or change this record. Recording of the content also need to be appropriate, and it is a professional discretion, as I mentioned. Security and confidentiality of these records. All these psychotherapy notes should be kept under custody. The custody is under the psychotherapist. And if you are an individual practitioner, if you are working in an organization like medical colleges, medical record department will keep these notes. However, psychotherapy notes can be kept separately from the medical records under lock and key. Please remember, you need to have a clear consent form, how the records will be given, who has access to these records, whether the patient has access to the records, what are the legal binding, confidentiality of these records, limitation of confidentiality has to be discussed. However, as per Mental Health Care Act of 2017, patient has right to basic medical records only, and a proper form should be given for asking for basic medical record. Maintenance of records. The therapist must organize and maintain records. Record keeping is part of the clinical practice. There is no excuse for not keeping psychotherapy notes or psychotherapy documentation. However, professional discretion has been given what to record and what not to record. However, basic medical records have been prescribed under the Mental Health Care Act of 2017. We need to have a policy with regard to retention of this record and when the disposal of records are done. These records should follow the statutory law of the land or the rules or the clinical guidelines. In a medico-legal case, you need to store the records until the case is disposed. If you are not keen on preserving the records, you can deposit to the subjective or to the court these records. Above information should be kept confidential, and if you are disclosing the information, please take informed consent from the patient. If the patient refuses to give the consent and the court is mandating to disclose this information to the court, please raise objection telling that the patient has not given the consent and request the court to order for disclosure of these records, and that to be recorded in the court notes, so that if somebody is challenging or the patient is challenging that you have disclosed the information to the court, it has to be on the court order you have disclosed the information. Now the question is, can we keep electronic records? Of course. The same legal rule, law which are applicable for physical records is applicable for electronic records also. Electronic records can be audio, video, or e-format. Many a time, combination of these records are kept. Please follow IT Act 2000 and rules. You can keep these records either locally in the hard disk or in the cloud or in combination of both. Please remember, you need to have a policy if you are keeping the records in organizational settings like medical colleges or hospitals. The officer in charge, especially in the medical record, that officer will be responsible for these records. If you are an individual practitioner, you are responsible. If there are multiple client records, that means if you are doing a group therapy or family therapy, you need to keep a separate record, or in the same medical record, you can have a separate subsection for each of the clients. One need to update about the knowledge with regard to clinical guidelines, rules, regulations, IT Act or legislation with regard to how do you store these records. Please learn about Mental Health Care Act of 2017, clinical guidelines, rules, regulation, IT Act, and various important information which are notified by the law with regard to electronic records. To conclude, my dear friends, therapists are responsible for documenting, maintaining, securing, storing, retrieval, and disposal of psychotherapeutic records. Therapists should know the elements of psychotherapy, documentation, and maintaining these records. Please update about your legal requirement for practicing psychotherapy, record keeping, documentation, and storing. Thank you very much for your valuable time. Stay safe.